Yes.
To me, that doesn't make sense.
So this is probably when they get tested. So it's probably when they get tested. I'm not sure how the testing goes, but when they get tested, that's where it shows up.
Yeah, I'm just thinking if they were tested and reported positive, then they would contact their partner unless they have multiple partners. So then they have to contact like 10 women for every one
Oh, I
man.
see. Yeah, I'm not sure. Yes, I'm not sure why the numbers are so high among women. So you might have just yes.
Is it possible that women contacting is just like easier? That's exactly what it is.
Yeah, so it could just be more easily spread in women. I'm not sure. Yeah.
Do you know if, is that included when they get a marriage license, you know, the state things
Yeah.
they have to test? Do they basically just test for everything?
I'm not sure what they do. Yeah, I'm not. Okay. Yes.
Where does this bacteria originally comes from? Like, if it was infected, where it came from?
Yeah. So the question is, where do these bacteria come from? I'm not sure about that. Often, what happens. So one is that it evolves from some other bacteria. So it could be evolved from other bacteria that we have, and then just became pathogenic. In the case of something like HIV, it actually came from an animal. It actually came from an animal version, and then crossed the species barrier and started to infect humans. Right, so that's another way that it could have originated. Okay. So it's just a matter of someone finding the relative to this. All right. So here's another one. This is also a concern because I know in our area we tend to be kind of high for syphilis compared to other areas in the country. This is caused by Treponema pallidum. That's the bacteria we talked about, spirochetes. This one has a very interesting disease course, which is why you hear about this in microbiology classes. What happens is that there's different stages of the disease. There's primary syphilis, which starts 2 weeks to 2 months after infection. Okay, and what happens is that there's a chancre that forms. Right? A chancre is a firm ulcer that forms at the site of infection. Right? So for males, this would be the penis. Right? Then it disappears. Right? So it disappears. However, the patient is still infectious. All right. So one problem with this is that when this ulcer goes away, the patient may think, "Oh, I don't have it anymore." Okay. But they're actually still infectious. What happens is that it can develop into a secondary form called secondary syphilis. This appears 2 to 10 weeks later after the first set of symptoms. And what happens is that now the bacteria is spread to other parts of the body. When it's spread to other parts of the body, it causes a hypersensitive reaction. Okay, so this is our immune system responding to that bacteria. And so now we get a rash, aches and pains, and mucous membrane lesions, and so now it's spread throughout the body. Right, so we see this rash across the body. Okay. This can last from weeks to months up to a year. The patient's still infectious. Now, I think so. Here's an example. This is the chancre. Okay. This is secondary syphilis. All right. So this is where you can see the rash appear. All around the body. This is actually a later form. This is actually a later form of syphilis. So what happens next is that the bacteria can progress further to tertiary syphilis. So again, this happens if it's untreated. This can appear years later. So this is where you have, again, a hypersensitivity reaction. And so this is where you have damage to large blood vessels, damage to eyes. This can lead to blindness. You can also have damage to the nervous system. This causes insanity. Okay, and so people actually go crazy. Right? So historians like to speculate whether Hitler actually had tertiary syphilis. Okay, patient's not infectious at this stage because there's so few bacteria, but there's a lot of damage. So this is what happens. This is a case of tertiary syphilis down here. Now, another issue with syphilis is that it can also affect the fetus. So there's a congenital form of syphilis. This is where we have miscarriage or stillbirth. You can have secondary syphilis in the infant. And what's notable about this particular disease is that you have effects. It causes birth defects. You have deformities in the face, teeth, and other body parts. So I think I have a picture of that. So here's an example of Tricher's of congenital syphilis. All right. Again, this is something you can treat with antibiotics. So penicillin is often a treatment for this. Any questions about this? Okay, so last time we looked at, in the last example we looked at chlamydia. Here's one for syphilis. Okay, so now what's different about syphilis versus chlamydia? Men, right? So yeah, so you see more predominantly among males. Okay, all right. So now we do have. So if you're wondering why it's more common among males, there is. Let's see. Did I have this table right? So. Rate, male rate, female rate, rate. Let's see, do I have this? The lines look too similar to me here. So one issue is, so one thing they track here is they track the male rate, and then they track the female rate. So what's happened is that the male rate has tended to increase over time. Okay. And actually, the reason why, does anyone know why? So there's actually an abbreviation they use for this. It's called MSM. All right. Do you know what that stands for? This actually stands for men having sex with men. Okay. All right. So that's the social dynamic that's into this. Okay. So now, as you know, in healthcare, right? In healthcare, we don't look at what the moral values are. We just look at what the facts are, and that's just a fact of what's happening. So that's why we actually see more syphilis among men. Okay, so that's why you hear. That's why you hear all the public messages about condoms, safe sex, right? Because that's the way that we're going to be able to control it. All right. The last two are again are diseases we hear about. This is herpes virus. Okay, so now we've talked. This is very similar to herpes that we've talked about earlier. So in this case, you have blisters and sores in the genital region. You have latency. The disease course is similar, where you have symptoms that begin to appear after a few days to weeks, then they disappear, then they recur again. When the virus is most transmissible is during the active symptoms. Okay, so and what happens here, because it affects the genital region, you get painful lesions in the genital region. And this is one that we can't cure. We do have treatments to control it. And the reason why we're so concerned about genital herpes is that this has a high association with cervical cancer. Okay? So that's why we're also concerned about herpes. All right, so this is a virus. Okay. The last one that I want to mention is genital warts. So this is caused by HPV. Human papillomavirus. And the reason why we're concerned about this one is that, again, this is a major contributing factor to cervical cancer, so herpes and HPV. Okay? Now, you've heard about So one thing that's popped up about HPV is what? What do we have now as another option, as an option? The vaccine, okay? And so who should get the vaccine? Young girls. And then somebody may know about another group. There was another recommendation. Now, so actually young males now.
Oh.
All right, so it turns out that young males can transmit the disease. And so now there's a recommendation that actually adolescent males, I think, is the other age group. All right. All right, any questions about this? Okay. What we're going to do now, we're going to take a little break.